Hello everyone, I'm Meena Noronha and I welcome you to another episode of Walk the Special Path. Today we have a distinguished guest today with us, Mrs. ANUPAMA Rajesh. She is a pediatric physiotherapist and associate professor at Father Muller Medical College. Basically, she is a Mangalorian alumni of St. Joseph School and St. Agnes PU College. She is a Master of Physiotherapy from Father Muller Medical College. She was recruited by Father Muller College as lecturer on July 2010 and has been working there in the physiotherapy department till date. Pediatric physiotherapy is her passion and she has been treating children with Down syndrome, cerebral palsy, autism, MR, spina bifida and variety of pediatric age group related diseases. She is a certified sensory integration therapist from University of South California Western Psychological Society. She has been a resource person for variety of regular or special teachers training programs hosted by Sarva Shiksha Abhiyan at district level. She was a resource person for Ayush doctoral training, Father Muller Medical College of Homeopathy. Welcome, ma'am.
Thank you, ma'am.
Today we are going to answer some queries about physiotherapy. I think all the special children out there, may it be autism, Down syndrome or any other issues, at one time or other, some children may need physiotherapy. Today we have a discussion with Ma'am ANUPAMA about why and how physiotherapy sessions will help a special needs child. So ma'am, first of all, welcome to the show and we are very happy that you are going to enlighten us about physiotherapy. So before we begin, let me ask you this, ma'am. What exactly is physiotherapy? Because people think it's basically some massage or taking a few sessions and a child is healed. So what exactly is physiotherapy and what it targets? How is it beneficial to a special needs child?
Okay. So definitely yes, it is not a massage therapy alone. Most of them have the concept of physiotherapy as massage, or physiotherapists are the massage therapists. So I would like to tell you that physiotherapy is much beyond that, and physiotherapy is a profession where we evaluate, train the children or the adults throughout wherever the whole across their lifespan. The physiotherapy would be required to maintain and facilitate the recovery of any kind of injuries or maybe any kind of disorders. And this is done basically by using certain kind of manual therapies like muscle and facial facilitation therapies. Then electrotherapy modalities also are used, TENS, then IFT, ultrasonography, laser therapy. All these things are used
so different types of therapies.
Yes. So it is not only the massage as such, like how most of them, because quite often when I visit some places also, they'll be like, oh, physiotherapy, this is a massage.
Right.
You're a massager. Yeah.
Right.
That is something that that shows that how there is a lot of lack of awareness about physiotherapy.
I think first we need to get people aware that physiotherapy is much more and it is very much needed for benefiting. It's not a short-term cure also.
Yes.
It's like it has to go over a period of time and slow and steady the progress is going to be there.
Yes. And moreover, physiotherapy has different branches, like if you're going to see, already I said it is from womb to tomb, in the sense from the childhood till the geriatrics we use. It can be beneficial. So from the childhood we have branch of pediatric physiotherapy, where we start the therapy sessions in for the high risk infants who have difficulty at the time of delivery, or they had delayed development, difficulty in sucking, or maybe they showed a drastic delay like of head control or maybe sitting.
Right.
So for all of them we start very early. And so pediatric physiotherapy is something that facilitates the development and gross motor skills as well as fine motor skills of the child with different varied disorders, like could be cerebral palsy, Down syndrome, or maybe as spina bifida, etc. Even for autism also, autism children, most of the time what happens is physiotherapy, when it comes to autism and learning disability, they tell that it is not required. But autism and learning disability also have the requirement, because autism, they show the developmental delay in their milestones. They might be delayed in walking. So what we do for autism and learning disability children is we combine the neurodevelopmental aspect of exercises with the sensory integration. So following which this sensory facilitation, when we give, they understand their body awareness more better, and following which they'll be able to execute the activities more better. So that is how for autism it will be used. And in learning disability, we have something called as dyspraxia. So for which again physiotherapy and sensory integration is very much important. Of course, with that we also require occupation therapy as well.
Okay.
Because
it's a teamwork.
yeah, it's a teamwork. Physiotherapy is something that is literally based on the teamwork. And when it comes to the adults, for orthopedic physiotherapy, any kind of musculoskeletal disorders, back pain, then even shoulder pain, osteoarthritis.
Right.
Now we have a lot of cases coming with lumbar disc prolapse.
Okay.
Mainly that is the most common problem. Everyone comes with back pain, and plus they have a lot of problems with the neck issues. Most of them are with the computer.
Many special children suffer that.
Yeah.
Posture.
Not only special children, I have got the cases where the children, the normal school going children are coming to us saying that they have neck pain, back pain. The main reason is they are either sitting posture or the digital working.
More with gadgets.
Yeah.
They're working with gadgets.
Not only that, and some people, they are forced to sit and study without any kind of activities.
Right.
Body requires activity.
Right, that's there.
So musculoskeletal physiotherapy is something that is dealing with the musculoskeletal problems irrespective of the age, and they also emphasize on the sports rehabilitation as well. So the sports rehabilitation in the sense like and they have injuries. Athletes usually end up with the ACL injuries, etc. So for that, for such kind of sports related injuries, our musculoskeletal physiotherapy is very important.
Physiotherapy is a very vast area,
Yeah.
and it's left to the parent and the expert to know which will work for their child.
Yes. Then we have some more things like neurophysiotherapy, mainly used for neurological condition. Then we have community-based physiotherapy, where the community that is not able to reach the mainstream of the healthcare profession, we go and reach. So from our hospital itself, we have a lot of extension services, camps, and we do a lot of tele-rehabilitation as well. During COVID time, we had done tele-rehabilitation. So this is all come under the community physiotherapy as such.
Oh.
Then we have again women's health, which is related mainly for the women's, especially the adolescent children come with a lot of PCOD problems and all that. So physiotherapy helps, benefits in that as well. Then geriatric rehab. So physiotherapy is something that is really wide variety, and of course it is throughout the age it will definitely require.
Okay, ma'am, coming to mental health now, we are talking about special needs children now, mental health. How does physiotherapy help in the mental health?
Okay, now mental health, definitely if you're going to see, we have to talk about two aspects, mental health and mental retardation.
Okay.
So mental health simply it is like the health mentally, how the person's mental health is like. It could be the feeling of depression, anxiety. So mental health disorder comes like that, whereas mental retardation is where the child's intellectual ability is not developed.
Right.
Or it is stagnant, or it is retarded at certain level, maybe at the time of in the womb, or maybe because of any injury postnatal. So it could be prenatal, before the delivery, or maybe after the delivery, or maybe in future because of maybe head injury or something like that. So physiotherapy for mental retardation, again this requires again a teamwork. It is not only the physiotherapy which will work for mental retarded children. It requires occupational therapy as well as psychological therapy as well. So in the aspect of physiotherapy, we help them again get the gross motor skills and as well as body awareness with a lot of different kind of sensory experiences what we give through the certain kind of techniques like swings, etc. So that way they will be able to have more better body awareness, and they can focus on the activities more better. But with all these things, repetition becomes very important, because without repetition they wouldn't have
Right,
that.
they need a lot of
Yes,
repetitions.
yes, definitely.
Ma'am. And that's a wonderful thing you said. Manju, now when we come to learning difficulties, how does physiotherapy, or what role physiotherapy helps in learning disabled children?
Now, learning disability, it is again a big umbrella term. So, learning disability means we know that there is some problem with the child's learning ability as such. They say that India accounts for at least 5 to 15% of schools have this learning disorder children, and quite
It's
often
quite a lot more than that.
yeah, no, each school.
Right, each school, yeah. It's lots.
Yeah, it's really lots. So that what happens is quite often it is unnoticed.
Right.
So learning disability, again, it has, again, since it's wide variety, you have something called as dyslexia, difficulty in reading aspects. So they might find it difficult to read, and they feel jumbled up or confused when they're reading the textbooks or
Right.
something. Then there is dysgraphia, that is a difficulty in writing. So they might not be able to cope up with the writing skills even after several training as well. And there is something called as dyscalculia. I think everyone knows about Abhishek Bachchan, who is known for his dyscalculia, and I think quite all of
I think
most
Tare
of us.
Zameen Pe was a movie which brought
Yeah.
dyslexia to the forefront.
Yeah. So that is really, it's actually true, where the children find it very difficult. And
So physiotherapy helps in these children, ma'am?
to a certain extent, when we use sensory integration and activity-based therapies, yes, it will help. But we have very main role in another one very important aspect of learning disability, that is dyspraxia. Dyspraxia is difficulty in activities or difficulty in doing activities. So these are the children who have problem with the planning of skills of how they are supposed to do. So when we are telling go and take a glass of water, so to go and take glass of water, first of all they should know they have to get up and go, and they should see where is a water resource, whether it is in the tap or whether it is in the aquaguard or whether it's a bottle. They should identify and then take. So it requires a lot of neurological process actually. So we help them by giving again a lot of activities and sensory experiences, so that they will have motor planning better and balancing better. These are the children, dyspraxic children, they have a lot of issues with the coordination and simple things like maybe just doing this kind of things also is difficult.
holding a pencil
Clapping
also,
also is
clapping.
difficult for them, or maybe we have rhymes to do this and all, so they will find it very difficult. They may not be able to follow to stand in the queues or something like
Right.
that. So that is all required for a child who is going to school. And so
Right.
with this kind of things, we help them understand more about the coordination skills. So we have re-education of coordination skills, and then we have balance training. Because of the coordination problem, definitely they will have a lot of balancing issues. These are the children who are known as a clumsy and
Right.
lazy. They may not be. You might see that they are walking a little bit slow because
they're
they are
not able
not
to stand still
Yes,
for
yes.
more time also.
No, that is again different aspects.
Okay.
Because some people will be standing still. Some people are not able to stand still. So that is depends on how their arousal level is again.
Okay.
So you have wide. Even with that one thing, we have
It differs
wide.
from each child to child.
Each child to child. Each child is unique and specific.
Okay.
So our management also has to have that much of patience
Right.
with wide variety of thoughts.
I think you need to, it's like each child based, they need based. It's
Yes.
a long process between the parent and the therapist to know what the child needs, where the child stands, and how to work.
Yes, definitely.
So now when we come to a special needs child, ma'am, a parent is told, oh, you have to go for therapy, you do this, you do that. They're so confused. So how can a parent know that the child needs physiotherapy as such? Because sometimes they think, okay, my child can't stand or can't balance, he needs physiotherapy. Not only in these cases, other cases also, because there's so many other children for even small matters. So how can a parent come to know, okay, my child needs physiotherapy? Speech therapy, it's very easy. Oh, he's not talking, he's stuttering, you can make out. But physiotherapy is a need which sometimes even for small things we need. So what advice would you give a parent, like how he can recognize that the child needs physiotherapy?
Okay, and this is something what I would like that everyone should know, because I'm not telling that you have to compare with the next child, but then definitely yes, we have certain red flags what we have to understand when the child has to accomplish a skill. So for example, by 3 months to 4 months, the child should be able to lift the head up.
Okay.
And by 6 months, the child should be able to sit. And by around 12 months to 18 months, the child should be able to stand independently and walk at least few steps.
Okay.
There are times when the child might be a little bit of delay, but then you observe the other skills also, how the child is accomplishing other tasks, whether the child is reaching. So by at least 3 to 6 months, the child should reach forward for the toys, should have eye contact by 6 months. And in case if there is some kind of delay, it is always better you go for a inquiry with the, or just a screening with the pediatric professional, like a pediatric physician or maybe a pediatric physiotherapist. Okay. So they will be able to analyze these things. Okay. Sometimes you might see that the baby is really cute and just that the baby is not able to do certain things, and quite often they will be like, they'll be going for the waiting strategies. So they'll be like, wait 1 year, 2 years.
Or there are people to say, okay, he'll see, he'll do.
Yes.
Wait.
And they will be like, sometimes I have even got patients where they're like, madam, we've want, all our ancestors says that it is like,
in our generations, everybody has done this late.
Yes. So it's everything late, and at least after 4 years the child will walk.
Right.
So that is something what whenever we have doubt, we have to go. But these are some of the red flags. Plus, if you're going to see some children, they have they'll sit in a very different specific manner. Like maybe they'll be sitting as like a W. They will not sit cross leg, but they will just keep their legs behind. Not even in like Vajrasana position. They'll be sitting and they will be hopping. They will not crawl. So all these small
toe walking also is.
Toe walking also. Toe walking has a wide variety of reasons. It's like just the toe walking, it's a very big chapter.
Can be but it can be a sign.
Yeah, definitely. It is one of the main signs for requirement of physiotherapy or some other.
Body balance, like they don't sit straight, or they'll be, leaning towards one side.
Or maybe they'll be doing repeated movements.
Okay.
You have to observe certain kind of other things, like whether they have a certain kind of repeated movement activities, like going on rocking or going on jumping, or maybe they are very unconsolably, irritably crying all the time, and they might be banging themselves, or they will be going on biting themselves. These are all sensory issues, what we call, and these children require exclusive sensory therapy as such. So quite often we see that there is a combination of all these things in children.
Okay.
So
that time they, if any doubt, means a parent should try to reach out to an expert.
Yes, definitely.
And clarify their doubts, I think. Thank you, ma'am, for that insights. Coming back to now, as you mentioned, physiotherapy is a wide range. So in that, I would like to ask, what is neurological physiotherapy?
Okay.
And how does it help special children? Because there's a lot of, as you mentioned, we can't work on all that. It's an umbrella term, physiotherapy. But I would like to focus on neurological physiotherapy and how it helps special needs children.
Okay. Neurological physiotherapy, as I told you earlier, it is a again a specialty concerned mainly with the neurological disorder. Okay. Now in neurological physiotherapy, again it has different categories, like neurological, pediatrics and geriatrics. Okay. Now pediatrics, as I said, it's till 19, and then we have any kind of disorders, like it could be the spinal cord injury, TBI, traumatic brain injuries, or maybe Parkinson's, stroke. Now you'll be surprised to hear that we have something called as juvenile stroke as well. Okay. That is the time of childhood or adolescence, they end up with stroke. Even cerebral palsy also, it happens with one, hemiplegia happens with one kind of stroke. Okay. So dealing with any kind of neurological conditions, that will be coming under neurological physiotherapy. So they work on more of the activities, and they want to improve the balance, they want to improve their abilities of gross motor skills like walking, sitting, postures, and then walking. And they have again, if you're going to see Parkinson's and all that, they will have again rehabilitation based on speed, etc. And here also we focus mainly on strengthening, stretching of the muscles. Then we have certain kind of techniques like the neurodevelopmental therapy. Then we have motor learning therapy, a certain kind of therapies which we use it for neurological rehabilitation as such. So if you are going to ask about the special needs, again here a neurological therapist definitely can help as a child to facilitate the neurodevelopmental in a child, and as they grow old they might require in the later stages also, so balancing, gait training, or basically walking training, all these things can be done. So
now coming back to what you said, I think those symptoms are present in cerebral palsy children. So how and what role does physiotherapy play for cerebral palsy?
Okay, now cerebral palsy is a condition where it happens where there is a damage to the immature brain or a developing brain. So the damage could have happened again within the womb or at the time of delivery, or maybe post delivery, maybe within 1 year or something. So but the brain development is up to happens approximately up till the 2 years. So within that, any kind of injuries or infections, all these things can lead for cerebral palsy. Now in cerebral palsy again we have different varieties. So varieties in the sense we have spastic cerebral palsy. In that we have hemiplegia, means one side is affected, diplegia means legs are more affected than upper limb. Then we have monoplegia, that is one limb is affected. So again there we have different categories in spastic cerebral palsy. Then we have dyskinetic, where in spastic cerebral palsy they cannot do the movement, all joints looks very stiff. Okay, and most of the time the hand will be like this and all that. But there is dyskinetic cerebral palsy. So that is something where the movement is not, they are not able to control the movement itself. They have a lot of movement disorder. They will be doing the hand movements.
They can't hold the glass.
They can't hold the trunk also properly. They will be wriggling around. Again, there are a lot of categories there in that specific cerebral palsy as well. Then we have ataxic. So all the varieties of cerebral palsy require specific treatment. For example, spastic cerebral palsy, where the movement is not happening. Our main focus is to get the movement.
Right.
So we'll be doing strengthening programs for the weak muscles.
It differs from, again, in that cerebral palsy, it differs from the needs of the child.
Needs of the child, definitely.
But physiotherapy helps a lot.
Definitely. Physiotherapy is the requirement, because and in that physiotherapy also, the earlier we treat, it is the better.
Yeah, that's always there. I think the earlier you accept that your child needs and you do it, take help of expert, I think you're on the road to recovery, at
definitely.
least. Again, ma'am, there are parents, they are confused when we should start. Or maybe I'll start tomorrow, I'll start next year, now we are busy. So what would you advise them? What is the right time or age to start physiotherapy sessions?
The right time is when they know that the child is having some problem with the development.
As early as possible.
As early as possible. So sometimes some of the cases, what happens is by the time they are born itself, they are called as high risk infants. So they might be having difficulty in breathing and all that. So for them, from the NICU itself, we will start with the physiotherapy. So pediatrician will tell you start up with the physiotherapy, we will start with the physiotherapy, and that will go on. So whenever they identify there is some kind of issues with the developmental milestone, that is all walking and sitting and all that, they have to start up with the physiotherapy. Now again, it could be, there are certain conditions like Duchenne muscular dystrophy.
Right.
Okay. For them also physiotherapy is definitely required, but they will be identified only after 8 years.
Okay. Their method will be different.
Their method will be completely different. Now here in for all these kids, we will be emphasizing on activities and repetition. There we can't give repetitions.
Right.
So the aspect is completely different. Right. So the earlier the more better, And very importantly, what I want to emphasize is, although they have started early and they must have got the milestone, the child must have walked by the age of 2 years or 3 years or 4 years, whatever. At the time of teenage, they have to do more vigorous physiotherapy or exercises.
The body changes more?
Body changes, definitely. We have at least 3 to 4 growth spurts. So following the growth spurts, what happened, the bone growth is going to be very quick.
Yes.
So within no time we'll see
and
that
time they'll complain lot of leg pain, hand pain.
leg pain, then they might be walking a little bit more straight, and during the growth spurt in the teenage time, you might see that the child is again going back.
Slouch also.
Slouch, yeah. Right. Because these kids, whoever have neurodevelopmental problems, irrespective of conditions, they have the problem that when the bone is growing, muscle will not grow matching to that.
Okay.
So bone grows like this and muscle is going to be short. So automatically they will slouch.
So or they need physiotherapy at that
teenage time. They require more physiotherapy.
Like more vigorous when their child are growing in these growing years. So parents out there, if you feel there's, today or now is the right time, when you feel your child is not growing according to others, or you feel a child is having some trouble at any time, please reach out for help. There are experts out there. There are professionals like ANUPAMA. There are, physiotherapists. Please reach out to them. Now is the right time to reach out if your child, and a parent can always decide, okay, my child, do not delay and do whatever the best. It's a teamwork between the physiotherapist, the parent and other therapist. So do what's best for your child. I think that's what ma'am wanted to say. Ma'am, coming back now, I would say a parent is always struggling. Now we spoke about the children. So how physiotherapy will help a parent emotionally?
I think physiotherapy is the backbone to support the parents emotionally.
Because they are always thinking, okay, it's a cure. Like, today my child can't do, like another thing want to say. Usually a parent will say, my child cannot walk, doing physiotherapy session. When will start walking? So parent is always thinking, it's like, it's like a magic cure, Today I start sessions, so many sessions you say, and my child will walk. So you think physiotherapy can help a parent emotionally?
Definitely it helps. So that is the reason why we emphasize more on the partnering of therapy sessions with the parents.
Okay.
So and we have something called as family based therapy or family centered interventions, where we take the we give a due respect for the parents' decisions, as well as we try to involve them for the therapy sessions, because we give therapy session only in our clinic.
Right.
At home, it is they who are going to take over. And how long they can come to physiotherapy? They can come maximum to 6 months.
Also, it's a struggle.
Okay.
Bringing them.
Yeah. In India, maybe we can call them every day.
Right.
We have the royalty of calling people here, but then in abroad, that's not possible.
And sometimes here also parents, especially now the rainy season, they can't come every time. So
rainy season, our clinic will be completely empty because it will pour and they can't carry and come. And even in case if they carry and come, what happens is the child will end up with fever. These children are very prone to catch up infections. So again, 1 or 2 weeks holiday, fully absent for the sessions, and then what happens, what we did, we'll lose back.
Yes, they regress.
So
so I think the parent should learn when the child is doing the session with the physiotherapist. You would advise that the parent also learns those?
We teach parents actually.
That's wonderful. That's really good.
So we make sure that they are involved, and even when they go back home, they will do the sessions. If not the difficult exercises, at least
I think it's a homework for the parents. You do the classwork and go back and
do it. I feel physiotherapy is a class to teach children's activities or development. And homework is a must when it is a class.
Right. I think yes, because it's not enough that one expert is doing and it's finished, and you expect results. I think it should be repeated at home.
But most of the parents, at the end of the day, everyone wants their child to be perfect.
Right.
And it is sad to say that it takes a long time for certain cases, but some cases, I'll be happy to say that some cases have recovered very beautifully and quickly. So. But
it's not always the case.
Not always the same.
Coming back to what I mentioned, ma'am, a parent will say, when will my child walk? now he's taking so many sessions over, still not walking. So what will you say at that time? I think you will get some parents like these who will say.
Yeah, I get a lot of parents like that. So they will come first, they said when the child will walk. So if it is a cerebral palsy child, I can say cerebral palsy Down syndrome child, yes. If the child has come to me with no head control, then I'll tell first I'll work on the head control.
Right.
So within 4 weeks or maybe within a month or 2 months, the head control will achieve. Then I'll work on the trunk. And after the trunk, the child slowly I'll be working on standing and walking. So by the age of 3 to 4 years, if it is really a bad condition, yes, it might take 3 to 4 years. But some children, if we are able to catch up from the beginning itself, they will recover very quick. It's like they must have got sessions within 6 months, they must have recovered.
Okay.
So again, it becomes very difficult for us to tell. So what we say is, if the child is sitting by 2 years, the child will definitely walk by 4 years.
Okay.
And if the child is sitting by 4 years, at least by 8 years the child will walk. There is no scientific papers to say this, but yeah, certain textbooks,
Right.
they
But again,
do.
differs, I think,
Yeah,
to each
definitely.
case.
And very importantly, for me again, it's a big challenge for if when I'm dealing with a patient who has epilepsy, especially when it is uncontrolled. Because we do therapy sessions, and I am very happy that yes, I got the recovery after so many sessions, and one epilepsy or uncontrolled
One episode,
epilepsy,
yes.
it's gone. So I usually advise no fever. The child should not get fever. If fever is there, please go and take medication fast, so
Right.
that the child will not
It differs
regress.
from age to age, and parents should understand that even physiotherapy is not a magic pill. You do so many sessions happen. You need patience. You
Yes.
need continuous hard work. So you will see the result, but can't say when. That's the thing. So for that, you really need to be patient, hardworking, and never give up.
Definitely.
I think that's correct, ma'am.
Yeah.
That. Thanks for enlightening. I think some parents out there who are thinking of asking, so they should understand from ma'am what she has told. You have to be patient. You have to work, and yes, it differs from child to child. Coming back to these children, ma'am, what is the specific mechanism basic for recovery of special needs these children in physiotherapy?
When it comes to mechanism, when we are studying, we have several mechanisms, but to make it very simple, repetition and consistency. These are the two mechanisms which each and every technique
Repetition and
consistency.
consistency. Okay.
So whatever the exercises, repetition and consistency is a very much important thing. The more you are going to repeat an activity or repeat a task or repeat an exercise, you will get definitely the results. So for a mildly disabled child, maybe the repetition might be requiring less comparing to the severely disabled child.
Right.
But definitely you will get results with repetition and when it is consistent. So it is as good as we are having food every day. We can't have once in a week rice. So in the same manner, reading or maybe even the exercises or maybe the rehabilitation, whether it is pediatric or whether it is it's just simple exercises, it has to be repeated and consistent. And pediatric physiotherapy exclusively works on the neural plasticity principle, which says that you use it, you have it. You don't use it, you are definitely going to lose it.
Right.
So we have to make the child use it. Even though the child is not able to do it, we have to repeatedly do certain kind of activities for the child, and repeatedly when we are doing, the neural pathways are going to be stronger.
Okay.
But again, when the neural pathways are going to be stronger with the repetition, when it is done consistently, we should also remember that the moment we are stopping it, it will again
Regress, go all the way
Regress.
back again. You
Yes.
understand? I think what
So-
beautiful things you said, ma'am. Repetition and consistency. These two things are the main mechanism.
With the neural plasticity.
Okay. And I think even for normal children, or for us also, if we repeatedly do, it comes to us more easily.
It is as good as now we are able to walk on the floor aram se, and if we want to walk on a balancing beam or a thread, we have to practice for that.
Right.
Fall and practice.
Yeah,
but we'll
repeatedly.
achieve it.
Right.
If we are repeatedly practicing.
And consistent. Yeah,
Yeah.
never give up.
Never
I think
give up.
all parents, please remember repetition and consistency.
Yes.
What ANUPAMA ma'am is saying, those are the two important things. Never give up. be repetitive, be consistent, and you will find wonders.
But yeah, techniques
Techniques,
that
yes, that is
therapist
there.
will be knowing, and they
Yes.
will tell you what
Yes,
kind
I
of.
think that's the basis. Once you learn that, and parents should not give up. They should try to keep this
Yes.
repetitiveness and consistency should be there.
Yes, quite often what happens, they will come, there are certain patients coming to me and telling like, I'll come for 1 week every day. I'm like, I don't want 1 week, not 1 week, 1 month every day. 1 month if you're coming, the last day you will be hating to see my face. And then next
Okay.
3-4 months you will not come. So you come either alternative days or twice a week, so that you will do every day at home.
They think, you do it, okay, we are,
Yeah.
especially if they can afford it, they'll say, okay, we'll come. And they expect that, I think, changes to happen fast.
Yes,
The more
yes.
you do, they think, we'll get a magic
Some
cure for
people
that.
are like, we'll stay from morning to evening, ma'am. You do the therapy and we will.
The parents themselves, they don't want to do that work, I think.
So I emphasize on
Right,
that.
that's very, very nice thing, ma'am, you told. So hope it reaches to all the parents.
hope.
It's good because this is a medium where we can reach out to more and more, especially as parents. And what you have told us is very correct. They need to practice that. And at home, it's not only the expert is going to do. The parents themselves should take the work to do. They have to take the time to do all these things. So, ma'am, now you have told us so much about physiotherapy. So, could you give us some examples where, with physiotherapy, special kids have achieved something? It can be very simple things or big things, but through physiotherapy, sometimes we think a child cannot do something. But with these therapies, through this behavior modification, there's nothing which a child can't do. So, could you give us some example where physiotherapy has helped to achieve something?
Yes, there are quite a lot of cases where I have come across one of the Dr. Janice Bronstorm. She is working in St. Louis Hospital in London, Washington. So she herself is a cerebral palsy child.
Okay.
Her mother had worked on her so much that even though she is a spastic diplegia, which means she is not able to walk properly like all others, she is a very good pediatric neurologist. And
Wonderful.
she herself emphasizes on the activities, and she has her own center for cerebral palsy, and she's doing a lot of research on cerebral palsy rehabilitation. So I feel she is one of the role model whom I would like to mention it for you, because no one would expect that a cerebral palsy child can be a doctor by herself.
Right.
Because most of the time cerebral palsy means they'll be like, that is difficulty in
Yeah, that
walking.
sort of
Yeah.
is in the wheelchair, can't do much like
Yeah,
this.
and another very important, it is our own Indian boy, Sujit Desai. So I'm a very big fan of him because he himself is a Down syndrome person, and he is having his own orchestra at the international level.
Oh, great.
And he plays nearly 7 instruments.
That's
So
superb.
violin is a difficult instrument to play, and he plays it awesomely, and he plays saxophone, piano, then so many kinds of this one. So he is one Down syndrome child who has been trained by his mother so much. I really say hats off for her, because she had trained him so beautifully.
I think our children are more smarter than we give them credit for. They need a push, they need a little,
Yeah.
intermediate help through therapists and all, and our children can work wonders.
And in our Father Mullers, recently we had celebrated Down syndrome day, and we had organized cultural programs for them.
Okay.
And we were mesmerized seeing those children performing so beautifully, dancing. And one 4-year-old child who is a Down syndrome came with that Yakshagana Talamadale.
Okay.
So beautifully he was doing the performance, and it was like everyone was so happy to see their performance, because when it comes to Down syndrome, everyone has a idea that Down syndrome is mental retardation. So
Yes.
intellectually they are very low, they are not able to do it.
I think all the special needs children, the mentality of people should change.
Yes.
They can do wonders, and especially with the benefit of like therapies, physiotherapy, speech therapy, I think it's on the way to success.
And you will not believe, I had come across one of the international student. We had a student international exchange program from India University, Malaysia, and I had a student who was himself a ADHD.
Okay.
I was like, he was standing in front of me and he was talking to me, but he would never have eye contact, but then he would be wriggling around and turning around and all that. I'm like, why are you behaving like ADHD? So he's like, ma'am, how did you diagnose? I'm like, I'm a pediatric physiotherapist, I can diagnose. But then I just simply said, he's like, no ma'am, I'm actually one. So his mom has trained him so much. So after the training, and now also every day in the morning he has to perform his sessions, which has been told for him, meditation, etc. And following which he is coming for the class.
Okay.
So that was very like, I'm like, being ADHD, he's doing physiotherapy. That also from Malaysia. So it was
It's
a lot of examples.
This, thank you for giving us an example. See, because of physiotherapy, you know, children can do wonders. So, ma'am, now you are a successful physiotherapist. I would like to ask how satisfied you are in your chosen field. What is your contribution to society?
Pediatric physiotherapy is something what I love to do.
It's a passion.
Yeah, it's my passion because I love kids.
Okay.
So it's like, and even when it comes to early intervention, it's something what I really want to work, because early intervention is a phase where I can get some changes in those children who.
And you'll be very happy, I think, to see the changes.
Yeah, and it is very quick.
Okay.
Up till the age of 3 years, whenever we are doing any kind of therapy sessions, we get quick results.
Okay.
So I love more of early intervention phase.
Okay.
Because I will get the results, and that is one phase where I can, I really emphasize on future generation of physiotherapy also to work on this early intervention phases, because we India, according to the Global Lancet report, we stand high for the disability.
Okay.
And autism, epilepsy, locomotor disability, we are all standing first, and ADHD we are standing second.
Okay.
So so it is like we'll have a lot of burden of disabled
Right.
at the later stages.
So they are working so much with these
Yeah,
children,
so
sir.
if we are working now, as when they are children, we'll have better adults as well as better geriatric age groups.
Right.
And they might be economically beneficial also, because usually they say that the person with disabled may not be economically beneficial, but if we are training them from the beginning itself, it will be more better. So my main focus is on that, and I'm very happy about taking this profession, and I emphasize that yes, more and more people we require for pediatric physiotherapy, because this is something where we can build our nation in more stronger manner, where we'll have a better growing population. So that is what I feel, and I'm very satisfied with my profession.
Thank you, ma'am. Thank you for sharing all this. Before we leave, I would like to ask you, ma'am, what message you would like to give to News Karnataka?
They are doing a definitely a good job of awareness, and when it comes to the News Karnataka, I would really tell them that they require more and more awareness programs like this. And thank you for giving me opportunity to tell all my point of view to
Right.
keep
It's
front
very
of the
helpful to
parents. So yes, but again we have to keep in mind that awareness with one program, it may not be enough.
Right.
So people require each and every time little and little
Again,
and
repetition
little
and consistency, I would like to bring.
Definitely, awareness also has to be repetition and consistency, otherwise people will forget.
Right.
So I would request News Karnataka and give a message that please repeat the awareness program
Right.
in different manners of different disability,
Right.
because we as a therapist is not only enough. We have to work as a team, whether
together.
it is a physiotherapist, pediatrician, speech therapist, and even the media, because media coverage is something that is required
Right.
now to flourish the awareness among the people.
Social networking is
Yeah,
very important.
and definitely we require lawyers also.
Okay.
Because there is a lot of requirement of legal aspects, especially
Right.
when we are trying to integrate the child into the school and certain
It's like a
things.
teamwork. We
Yes.
all come together, and media is an opportunity where we can, spread it more.
Yes.
Coming together. Thank you very much, ma'am. Thank you for a very insightful session, and you have answered so many of our physiotherapy questions. Thanks a lot.
Thank you, ma'am.
And before we end, to all the parents out there, please don't give up. Always hold on to that hope. As Ma'am Anupama told us, repetition and consistency is the key to progress. Don't give up on your child. There are experts out there. Reach out. And now is the time when you realize your child needs physiotherapy. Please go and take the help of experts. And yes, your child can do wonders. She has given you some examples. Your child can be an example. Never give up in your child, and always acceptance, inclusion, awareness, as well as repetition and consistency are the keys. And thank you everyone for joining us this session. Thank you.
Thank you.